Approximately 20% of elderly patients admitted for altered mental status are suffering from sodium imbalance rather than dementia or stroke, reports the Journal of the American Geriatrics Society. This hidden health crisis affects countless seniors, yet most caregivers aren't trained to recognize it. In this video, we're examining why elderly bodies process sodium differently, how common medications trigger dangerous imbalances, and the specific monitoring techniques that prevent emergencies. Whether you're a full-time caregiver or occasionally check in on an aging parent, these insights are essential. Stay with us to discover how small adjustments in care routines can protect your loved one's cognitive health and potentially save their life. The silent crisis. Why elderly bodies process sodium differently. Have you ever wondered why a medical condition that affects 1 in 5 hospitalized seniors remains largely unrecognized by most caregivers? Sodium imbalance in the elderly isn't just another health concern. It's a silent crisis that deserves our immediate attention. Take the case of Eleanor, an 82-year-old who became confused and lethargic after a minor medication change. What her family mistook for early dementia was actually a dangerous sodium imbalance that required hospitalization. Her story illustrates how aging bodies become vulnerable to electrolyte disturbances in ways younger adults simply don't experience. As our bodies age, significant physiological changes occur in how we process and regulate sodium. One of the most profound changes occurs in kidney function. Research shows approximately 2/3 of adults over 40 already experience natural kidney decline, with this deterioration accelerating after age 65. Think of aging kidneys as filters that have become increasingly clogged, where once they precisely controlled sodium levels, they now struggle to maintain proper balance, creating dangerous fluctuations that affect everything from neurological function to cardiovascular health. Connected to this kidney decline, many seniors experience a diminished thirst sensation, a condition known as hypodipsia. By age 80, this internal water gauge has often malfunctioned so significantly that some seniors can become severely dehydrated without ever feeling thirsty, causing sodium to become dangerously concentrated in the bloodstream. The hormonal systems regulating sodium also undergo significant changes. The renin-angiotensin-aldosterone system, acting like an aging thermostat that no longer responds accurately to temperature changes, becomes less efficient in elderly individuals. Similarly, antidiuretic hormone responses become blunted, further compromising the body's ability to maintain proper sodium concentration. Common medications prescribed to seniors introduce another layer of risk. Diuretics for high blood pressure, certain antidepressants, anticonvulsants, and even some antibiotics can dramatically alter sodium levels in ways that younger bodies would typically compensate for. When these medications interact with an already compromised regulatory system, the effects can be profound and sometimes life-threatening. Body composition changes also contribute to this vulnerability. As muscle mass is replaced by fat tissue, the body's total water content decreases. Since muscle holds more water than fat, elderly individuals have a smaller reservoir of body water, creating a narrower margin of safety for sodium balance. Even minor dehydration or excess sodium intake can quickly push an elderly person outside the safe range. Understanding why sodium balance is especially critical requires recognizing that elderly bodies have fundamentally different regulatory mechanisms than younger adults, where even small changes can trigger serious imbalances. Dangerous disguises. Recognizing sodium imbalance when it mimics other conditions. This compromised sodium regulation creates a particularly troubling challenge. Its symptoms often wear disguises. In fact, studies show that healthcare professionals misdiagnose sodium imbalances in elderly patients at alarming rates, primarily because the initial symptoms so closely resemble other age-related conditions. Mom seems more confused today. The doctor says it's just her dementia progressing, Sarah told the geriatric specialist. 2 days later, after proper testing, Sarah received unexpected news. Her mother had treatable hyponatremia, not worsening dementia. This scenario plays out in countless senior care situations where sodium imbalances go undetected, while families struggle with what appears to be irreversible decline. Sodium imbalances manifest through subtle changes that blend seamlessly with typical aging concerns. Low sodium levels, hyponatremia, primarily affect cognitive function, creating confusion during conversations, unexplained irritability, and personality shifts that families attribute to dementia or normal aging fluctuations. High sodium levels, hypernatremia, present an entirely different profile. Extreme thirst, noticeably dry mouth, and increased agitation that caregivers and physicians sometimes mistake for anxiety disorders or medication side effects. These misidentifications delay crucial treatment while the underlying condition worsens. What makes this situation particularly dangerous is that both conditions can rapidly escalate beyond discomfort. Without proper intervention, hyponatremia and hypernatremia can progress to seizures, loss of consciousness, and potentially coma. Elderly patients face heightened risks for these severe outcomes due to their already compromised physiological systems. The diagnostic challenge extends beyond home care. Even in clinical environments, sodium imbalances frequently receive incorrect initial diagnoses. Healthcare professionals, pressed for time and facing patients with complex medical histories, often attribute cognitive changes to more recognized conditions like dementia without investigating electrolyte levels, despite sodium imbalance being a common, treatable cause of mental status changes. Hospital data reveals serious consequences. Elderly patients with hyponatremia experience significantly higher hospital admission rates and longer stays. These extended hospitalizations expose seniors to additional risks, including hospital-acquired infections and functional decline. Early detection remains challenging because symptoms can be mild or absent until reaching critical levels. Some elderly individuals show no obvious warning signs until the condition becomes severe. Key indicators include subtle cognitive changes, unexplained fatigue disproportionate to activity, gradual increases in confusion, developing muscle weakness, especially when standing or climbing stairs, and alterations in urination patterns. Recognizing these disguised symptoms requires vigilant monitoring and a willingness to question assumptions about normal aging. The next section explores practical strategies for tracking these subtle changes before they become medical emergencies. Hidden dangers, medications and foods that affect sodium balance. Beyond watching for symptoms, there's another layer of sodium risk that often goes unnoticed. That bottle of heartburn medication in your loved one's medicine cabinet could be silently disrupting their sodium levels, and it's far from the only culprit. While we've discussed how aging bodies process sodium differently, many caregivers remain unaware that common medications and everyday foods create additional hidden dangers. Several medications commonly prescribed to seniors can alter sodium balance in concerning ways. Proton pump inhibitors like omeprazole for acid reflux, antidepressants including citalopram and fluoxetine, over-the-counter antacids, and even certain vitamin supplements all pose potential risks. Research has documented specific cases, 19 instances of hyponatremia linked to citalopram and 14 cases associated with fluoxetine in elderly patients, highlighting how these routine prescriptions can silently alter electrolyte balance. Even mineral-enhanced bottled waters, despite their health-promoting reputation, may introduce considerable sodium when consumed regularly. These medication risks combine with dietary factors to create a dangerous double threat for seniors. Processed foods act as stealthy saboteurs in elderly diets, undermining health while appearing convenient and beneficial. Their sodium content often goes undetected until health problems emerge. For seniors with already compromised regulatory systems, understanding typical sodium consumption is crucial. The average American consumes approximately 5 teaspoons of salt daily, 20 times more than the body actually requires. This excessive intake creates particular dangers for older adults whose bodies struggle to maintain proper electrolyte balance. Many processed foods appearing regularly in senior meals contain concerning sodium levels. A single serving of canned soup can contain more than 500 milligrams of sodium. Similarly, deli meats and certain breakfast cereals frequently exceed this threshold, despite not tasting particularly salty. This disconnect between perceived saltiness and actual sodium content creates a dangerous blind spot for caregivers. The challenge extends to identifying hidden sodium in seemingly innocent foods. Items labeled pickled, brined, or cured typically contain high sodium and should be limited. Even standard grocery staples harbor unexpected amounts. Canned vegetables often contain added sodium for preservation, while sauces and condiments pack significant sodium despite mild taste. While excessive sodium presents obvious concerns, insufficient intake deserves equal attention. Some seniors, following medical advice to reduce sodium, may restrict consumption too severely. This risk increases substantially when combined with medications that independently lower sodium levels, potentially creating a dangerous compounding effect that caregivers might not anticipate. Regular label reading becomes essential for effective monitoring, with special attention to terms like sodium, salt, soda, and Na in ingredient lists. Practical monitoring: how to track sodium balance without medical equipment. That sensory disconnect between taste and actual sodium content creates a critical monitoring gap for caregivers. While blood tests measure sodium levels directly, they only capture a moment in time and require medical visits. The most powerful tools for detecting dangerous imbalances before they become emergencies are actually already in your home. Everyday observations that can reveal what even your loved one's doctor might miss between appointments. Your home contains several effective monitoring tools that require no special training. Weight changes. Your bathroom scale detects sodium-related issues through weight fluctuations. A change of more than 2 pounds within 24 hours indicates fluid retention or loss connected to sodium imbalance appearing before other physical symptoms develop. Urination patterns, changes in frequency, color, and volume signal developing sodium problems. Dark urine indicates dehydration, while almost colorless urine suggests proper hydration. A simple note about these characteristics provides valuable data. Cognitive function. Daily conversations offer opportunities to assess mental clarity. Attention to whether your loved one follows conversations as well as yesterday or recalls recent events can reveal early warning signs without causing anxiety through obvious testing or quizzing. Physical symptoms. Morning care routines provide time to check for ankle swelling, facial puffiness around the eyes, or unusual fatigue, all potential indicators of sodium-related fluid retention that often follow predictable patterns. Consider Martha's experience. When she noticed her father gained 3 pounds overnight and seemed slightly confused during breakfast, she contacted his doctor immediately. This observation led to a medication adjustment that day, rather than waiting for his scheduled appointment the following week, potentially preventing a serious emergency. The true power of these observations emerges when organized in a simple daily log. Think of it as a care diary with dates, weights, observations about urine, cognitive status, and medication adherence. This creates a personalized baseline where concerning changes become immediately apparent. Healthcare providers often find these logs invaluable during appointments, leading to timely interventions. For additional options, affordable tools like urine electrolyte test strips provide non-invasive sodium level checks, while more sophisticated options include handheld digital analyzers. Regular blood pressure monitoring can also serve as an indirect assessment method. Studies confirm that proactive home monitoring significantly reduces hospitalizations related to sodium imbalance through early detection. Many caregivers report that implementing systematic monitoring helped them identify patterns that prevented emergency situations that had previously resulted in hospitalizations. Start your monitoring routine today by selecting the observations most relevant to your situation and creating a simple log. This small step could prevent serious medical emergencies before they occur. The impact of early intervention in sodium imbalance cases cannot be overstated. With prompt treatment, elderly patients experience significantly better outcomes. Research shows a 74% 3-month survival rate for those with hyponatremia compared to 83% without it. This survival difference highlights why vigilance matters. Many elderly individuals don't exhibit obvious symptoms of sodium imbalance as their body's warning systems naturally decline. Seniors often can't recognize their own dehydration or electrolyte fluctuations, making your consistent monitoring their essential safety net. When caregivers track food and fluid intake while staying alert to subtle changes, they become guardians of their loved one's health, creating a protective barrier against life-threatening complications. Your informed observations transform potential crises into manageable conditions.